Back to the breaking news today about masks. Philadelphia's acting health commissioner is recommending that people wear masks indoors in public spaces, even if they're fully vaccinated.
Of course, this comes as cases of the Delta variant continue to surge. Let's bring in Dr. John Wherry, director of the University of Pennsylvania's Institute for Immunology. Great to have you with us. Your insight, Dr. Wherry.
Thanks for having me. Glad to be here.
What do you make of the recommendation?
Yeah, I think the pandemic has never been about just one strategy to control the virus. So we're seeing a rise in this Delta variant. Our vaccine implementation has lagged a little bit. Masks do prevent spread. We know that the vaccines prevent disease if you're vaccinated, but you still may be able to spread. You still may be able to catch the virus and get a little bit sick. So I think especially when you're around lots of people, you don't know their vaccine status, the use of masks is still a really important tool in our toolbox to limit the pandemic.
So Dr. Wherry, do you believe, in your opinion, are we taking a step back here? A lot of people are wondering, are more restrictions coming? Are we going to move back to where we were several months ago?
No, I really hope not. I think what we're seeing is that we just have to continue the push. We saw this in Israel when they were vaccinating really well and there was a blip up in spread of the virus again. And they had a very short, just couple weeks of increasing use of masking and social distancing again. And it really got things under control quickly. So I think this is a minor course correction to try to make sure we really finish this job. At the same time, we have to get our vaccination rates up.
Yeah, I know getting people vaccinated is certainly the way out of this pandemic. Do you fear this may send a mixed message as far as those who still haven't received the vaccine? Why should I get the vaccine if I still have to mask up?
Well, I think what we know for sure is the vaccines are really preventing people from getting severe disease if they do get infected. Now, we should have some reduced restrictions if you are vaccinated. So certainly if you're around small groups of people who are all vaccinated, there's no need for a mask. In large areas, public areas where you don't know the status of people around you, they're young kids who can't have received the vaccine yet, it's really about protecting those around you that's important. So there is a benefit to having been vaccinated, and we are seeing a loosening of restrictions and increased ability to return to some aspects of our normal life. This, I think, is just a small blip on the course to getting back to normal.
And just to really sort of hammer that home, Dr. Wherry, can you explain, we are hearing a couple of examples here and there of people who are fully vaccinated and they are still getting sick. The thing to focus on, though, is how much sicker they would potentially get if they weren't vaccinated, correct?
That's exactly right. So no vaccine is 100% perfect. We are going to see breakthrough infections. But the big take-home message is that those people, by and large, are not getting nearly as sick as the unvaccinated people. We've seen statistics from various states, sometimes to the effect that 100% of COVID deaths in the month of June were all in unvaccinated, and similar statistics in other metrics of how severely sick you get.
We certainly need to stay focused and remember we are not out of this. Dr. John Wherry, certainly once again appreciate your insight.